Okay, let's talk about something that can be, frankly, pretty terrifying for any expectant parent: bleeding during the later stages of pregnancy. But here's the thing. In situations like this, knowledge is absolutely power. Understanding what might be happening, and why, is the first and most critical step. So today, we're going to break down exactly what you need to know about something called antepartum hemorrhage.
So here's our game plan. We'll start with the absolute basics. What exactly is antepartum hemorrhage? Then we're going to zero in on the two main things that cause it, and this is the really important part, learn how to tell them apart. After that, we'll walk through what the medical action plan looks like in an emergency, and we'll wrap it all up with what you can do to be proactive and the key things to remember. All right, let's dive right in. Section 1. What are we actually talking about when we say APH? Let's get a really clear, simple definition, because this term is the foundation for everything else we're going to cover.
So how common is this, really? Well, it happens in about 2 to 5% of all pregnancies. Now, I know that might not sound like a huge number, but think of it this way. That's potentially 1 in every 20 pregnancies. It's definitely common enough that every single expectant parent should know what the signs are. So here it is, the official medical definition. Antepartum hemorrhage, or APH for short, is any bleeding from the genital tract after you've hit 28 weeks of pregnancy, all the way up until the baby is born. And I really want to be clear about this. This is not a wait-and-see kind of thing. In the medical world, it is always treated as a major obstetric emergency where every single second counts. So the big question is, what's actually causing this bleeding? While there are a few different possibilities, the truth is the two specific problems with the placenta are the main culprits. And because they're the most common and the most serious, that's exactly where we're going to focus. And just take a look at this breakdown. You've got Placenta Previa causing about a third of the cases, and Abruptio placenta causing another third. I mean, together, they're responsible for the vast majority of all APH events. So it's pretty simple. If we can really get a handle on these two conditions, we've basically solved the biggest piece of the puzzle. And that brings us to what I think is the most critical part of this whole explainer: spotting the differences between Placenta Previa and placental abruption. They might both cause bleeding, sure, but their other signs are actually really distinct. And knowing how to describe those signs can make all the difference in getting the right help fast. First up, let's talk about Placenta Previa. So in a typical pregnancy, the placenta attaches way up high in the uterus, out of the way. But with Previa, it actually implants way down low, so low that it can partially or even completely block the cervix. You can think of it like this. It's literally blocking the baby's only exit door. And here it is. This is the absolute #1 key identifier for Placenta Previa. The bleeding is almost always described with these 3 words: sudden, painless, and bright red. That specific combination is the classic textbook sign, and it's a huge signal to get medical help right away. Now, because that placenta is sitting in such a vulnerable spot, there is a hard and fast rule for doctors and nurses. If there is even a tiny suspicion of Placenta Previa, a digital vaginal exam is completely 100% off the table. It's forbidden. The risk of accidentally poking that low-lying placenta and causing a massive hemorrhage is just way too high. Okay, so now let's switch gears and look at the other major cause: Abruptio placenta. In this situation, the placenta is in the right spot, high up in the uterus. The problem is, it starts to peel away or separate from the uterine wall way too early. It's kind of like the baby's lifeline is detaching from its power source before it's supposed to. And boom, right away, we have our first massive difference. The classic sign of a placental abruption is painful vaginal bleeding. Remember how we said Previa was painless? Well, this is the complete opposite. That one little word, pain, is the single biggest clue that you might be dealing with an abruption. So let's just hammer this point home, because it's so important. The #1 question to ask is, does it hurt? If the bleeding is painless, the first thing you think of is Placenta Previa. But if there's significant pain with the bleeding, you have to suspect Abruptio placentae. It is the most fundamental difference between the two. Next up, let's talk about the color of the blood. With Previa, it's often bright red. That tells you it's fresh bleeding, coming right from the source. But with an abruption, the blood can sometimes be darker, almost a brownish color, because it might have been trapped behind the detaching placenta for a little while before it found its way out. And finally, there's the feel of the uterus itself. With placenta previa, the uterus usually stays soft and pretty relaxed, but with an abruption, that internal bleeding can really irritate the uterine muscle, causing it to become super tender, hard, and what doctors call board-like rigid. It's a very distinct, tense feeling.
Okay, so let's put it all together in one spot. This table really gives us the full picture side by side. You've got pain, painless for previa, painful for abruption. Blood color, bright red versus dark. The uterus, soft versus rigid. And then you can see the consequences. Shock and fetal distress are way more common with an abruption, which is exactly why spotting these signs is so incredibly critical.
All right, so what happens when someone gets to the hospital with suspected APH? Well, even though it's a huge emergency, there's a very clear, very systematic action plan that kicks into gear. The goals are simple and immediate. Stabilize the mother and figure out how the baby is doing. And fast.
The first response follows the classic ABCs of any emergency. A is for airway, making sure it's clear. B is for breathing, often giving oxygen to help out. And C is for circulation, which means a team is quickly getting IV lines in to give fluids and, if necessary, blood to replace what's been lost.
Now, at the exact same time all of that is happening, a whole team is running tests. They're drawing blood to check for things like anemia and to see if the blood is clotting properly. They're getting blood ready just in case a transfusion is needed. An emergency ultrasound is usually done to find out exactly where that placenta is. And of course, the baby is hooked up to a heart rate monitor, a CTG, to keep a constant eye on how they're handling the stress.
Okay, so we have covered the what, the why, and the how. Now for the final and really crucial piece of the puzzle. What can you actually do to be proactive? Let's talk about prevention and really lock in the key things to take away from all this.
So while you can't prevent every single case, good prenatal care is your absolute best defense. This means going to all your regular checkups, managing any conditions you have like high blood pressure, trying to avoid any trauma to your abdomen, and using that early ultrasound to know exactly where your placenta is. And, of course, for anyone who is identified as high risk, planning for a hospital delivery is just a key safety measure. Look, if you only remember one single thing from this entire explainer, please let it be this. Never, ever ignore bleeding in late pregnancy. Call your doctor or midwife immediately. And remember that the difference between painful and painless bleeding is a really powerful clue that can help you describe exactly what's going on.
So we'll leave you with this question to think about. Knowing the signs, that's the first step. But how do we actually use that knowledge? How can those routine prenatal appointments, those regular check-ins and scans, become tools that truly empower you, turning this information into a genuinely safer pregnancy journey? Thanks so much for joining us for this explainer.